Hello, everybody. Today we are going to go over insurance claims process, corrections, and appeals. So this is actually a field that I really love. So I love dealing with the insurance portion. You'll hear Alicia say she hates this side. I love it. So everybody has their own thing that they find that they like. Dealing with our job or doing our claims and coding, and there's just certain things that you just love, and this is it for me. So sometimes, people who code, they kind of don't understand the other side of the process. So once they put in the code, what happens to it? Most of us kind of know the general idea. You might have been around a doctor's office or a billing company long enough to understand what happens. But now if we kind of take a look at what we call the backside of that claim that the code is being submitted for, and how does it all come about on the other end of getting the payments. Of course, we love to just enter the claim and get the payment right away. That doesn't always happen. So sometimes we have to do a correction or an actual appeal, send it into the insurance carrier to try and get paid for the services that were provided to our patients. So in the insurance claims process, we have, of course, our demographic and our charge entry, and that demographic information is extremely important. So whether you have somebody who's doing your data entry, whether you have some kind of interface with a computer program, whether you use a keypad or kiosk or iTablet or something like that for your patients to enter all the information themselves, and it integrates with your practice management system or your EHR system, or whether you actually have somebody keying in all that information based off of the form that somebody filled out or an online form or something. So that demographic information is very important because actually certain fields of that insurance claim form, which is where all that demographic information is going into the claim form, they must be filled in or that claim is going to get kicked back. So some people may not think it's very important to have to include certain information, but it is required. And there's actually, I included a lot of websites as well, and some of them will describe for you exactly which items need to be filled in order for that claim to be processed. So we all understand, of course, name, date of birth, very important. Well, a lot of people don't think of the policyholder's information. So all of that information needs to be included as well, because that's pretty important as well. They are the ones who hold that insurance policy. So when the claim gets there and it only includes the child's information, it may be more difficult to find that policy member. And charge entry, of course, is super important, making sure to remember all of our modifiers, the specific ICD-10 codes, any HCPCS codes, anything relevant to the services that were provided. And if we're filing Medicare claims, then of course all of those extra, used to be PQRS, so your MIPS information, all of that extra information that needs to be included on the claims in order to meet the qualifications with the insurance carriers, or there will be a deduction in your payment. So we're definitely trying to avoid that. So once this information is all entered, it goes to your clearinghouse, or if your office deals directly with the insurance carrier, whether they deal with Cigna through Navinet, file Blue Cross straight on the Blue Cross website, or specifically to a clearinghouse, which gathers all that information for you and divvies it off or submits it off to the individual insurance carriers. Now, there are insurance carriers that are pretty small. So you think of like your little union groups or a small carrier for an employer group. So they may not have an electronic claim submission, but you send all your information electronically. Well, when that happens, that you send it all to a clearinghouse, that clearinghouse actually drops that claim to paper format, and that's what we call it. They drop it to paper. And they will then submit that paper claim to the insurance carrier if they are small and don't have EDI information. So it's possible you're sending all your claims electronically, but the carrier may be receiving them via paper as well. So of course, our large carriers, Medicare, Aetna, Cigna, Blues, they are all going to have electronic data interchange. They're all going to receive that information electronically, spits it right into their computer. Most of the time then it's the computers at these large insurance carriers that are processing all the claims. So of course, if a computer is doing this claim, it's possible there could be an error. So not all the time is there a human actually reviewing every one of these claims, especially when you look at Medicare. For that, you submit your claim and get your payment back within 10 days. For a person to be reviewing those claims, I think that'd be a really stressful job to have to get them back there that quickly. So that's pretty much a computer doing all that job for you. Then we go through the insurance claims processing. So once it gets to the insurance carrier, then they review the claim, whether it's a computer or a person. They are going to review all that information, make sure it doesn't go against any NCCI edits, make sure everything's not bundled, make sure it's modified properly, make sure you have the correct patient information. What if you have an ID number that's been miskeyed? Well, you know, they have that patient at date of birth, name, but it's not matching with the ID number. So it could kick things back once it gets to the insurance carrier as well. So it could get kicked back from a clearinghouse. It could say, no, this is not what we call a clean claim. Or it could go all this way to the insurance company and then they deny it and send it back electronically saying we cannot process this claim for a specific reason. And of course, once they process the claim, you get your payment, hopefully, or you could possibly get a denial. So we are going to go over some of those as well. So like we said, your demographic and your charge entry information is very important to make sure that it is correct. So if you have an encounter form or a super bill or whatever your office calls them, if you receive them that way via paper and then somebody's manually entering all this information, then you want to make sure that you can actually read the information that they gave you. Now, in the olden days when I first started, of course, everything was handwritten and we still entered it in a computer. But when you have the chicken scratch from those doctors and you can't tell that exact diagnosis that they're giving to the patient, then you had to query the provider and find out what they came in for, possibly give them the paper chart and send a message back to them and have them look at the information. So a lot of things have gladly come around with the computers. You might be able to decipher this information a little bit easier, or perhaps your system actually integrates with your EHR. So all the provider's doing in the EHR is tagging the information and it gets submitted, and then somebody in your billing department is just kind of reviewing it, making sure that that diagnosis goes along with that claim or that it doesn't need a modifier of some kind. But we actually have certain standards that have been established as to what has to be included. And I made reference to some claims manuals that they will tell you exactly what needs to be on those claims. Well, part of HIPAA, everybody knows HIPAA by now, and if you don't, you need to learn it because any certification exam you're going to take, no matter the certification, is going to include information about HIPAA and some of the other laws that were enacted. So HIPAA actually makes a mandate of the national standards. This way, everybody is getting the same information. So you're not saying, oh, Blue Cross wants us to include this, but Aetna wants us to include something different. So there are national standards that every carrier has to accept. So that way you know what information needs to be included on a claim form for everybody. Everybody will follow that. But that also gives you national standards for how the payment's received. So all of the denial codes, everybody uses the same denial codes. And I have a link to the website where you can find all that information. The remittance advices, explanation of benefits, explanation of remittance. You'll hear it called a lot of different things. Some carriers will call an explanation of benefits what they give to the patient, and they'll call an explanation of remittance what they give to the provider. So it's name that's used kind of interchangeably. Most people understand what you're talking about when you say an EOB or EOR or RA. They can be called any different thing. That is the statement from the insurance company that comes back to you with all of your compiled information on the claim, telling you what they paid, or if they didn't pay, telling you why. And then you can also your claim status information. All has a national standard, so they're not going to be vague. You're not going to call and find out where the claim is, but then not understand what's going on with it. So they have standards set up with HIPAA that everybody needs to follow. Of course, a lot of that includes your HPI, your personal information. So PHI, sorry. So your PHI includes that as well. So a lot of this information that we're sending electronically, we have safeguards enacted by another law called High Tech that we need to make sure we have safeguards protecting all this information. Because what is it you're sending out to the carrier? You're sending out information across electronic lines about a patient's name, their date of birth, their insurance information, their medical history. That, they have a code and a diagnosis included. So you're giving a lot of information away when you're sending these out. So everybody needs to make sure their information is safeguarded under these same laws. So also when you ask for your eligibility information, is this patient eligible with this insurance carrier? You're going to get back a standardized information, whether it's their deductible, their copay, their eligibility date, what kind of plans they have, how many visits they're allowed, if they need referrals. All that information is going to come back the same. Referrals are now almost standard. They have to include certain information on them. Everybody may have their own format, but a lot of them you also see are now being sent electronically. And a coordination of benefits. So coordination of benefits means, is there another health insurance provider out there covering this patient as well? So a lot of people do have another insurance plan, especially when we're talking about Medicare patients. They have a secondary claim maybe with AARP or TRICARE for Life or Blue Cross Blue Shield. They could have another insurance carrier. So that could be another topic all in itself, talking about coordination of benefits, because you get into things called the birthday rule. You get into when is a insurance primary or secondary, is the patient still working, how large is their employer. So there's a lot of other information that goes in along with coordination of benefits. There's other information that's been mandated as well for the EDI, the electronic data interchange. So everybody needs to use the same HCPCS codes, the same CPT, ICD-10-CM, or PCS. Those are all mandated. That's why we study all this information, because everybody uses it. They may not allow the same things, but they all use the same set of codes, the same set of diagnoses. NDC, that's your drug identifiers. So there's certain codes assigned to every medication, every drug, anything that you use, that you distribute or dispense or inject. They all have an NDC number on them. And that's how this is identified when you submit that information as well. Your dental codes are also all standardized, as well as your place of service codes. When you say a 12, everybody knows that that place of service took place at the home. Well, and then if that place of service is 12, certain information has claim form. If the place of service is 21, some kind of ambulatory surgery center, you need to make sure you're indicating where that surgery center was, where that hospital was, where that service took place. So all that information is all standardized on our claim forms. So once it goes to the clearinghouse, they're going to check for clean claims. So there's certain things that must be on your claim for it to be considered clean. Of course, we have to have those fields all filled in: the date of birth, the patient name, and ID number. If there's another insurance carrier, there's certain information that's required for the supplemental insurance carrier. You need to have a place of service. You need to have your dates of service. All this information needs to be included on a claim for it to be considered clean. If it's not, it's going to get sent back to you at the office on a report of some kind saying this is missing this information. And typically you'd go onto your practice management system, into your claim submissions, and correct that field so that the claim can be sent again. Once you do that, go back into the patient file and update it there, because otherwise you're going to keep getting that claim sent back to you because it's missing that required information. It checks for any errors in your data and it will return it to you, or it's going to forward it on to the insurance carrier. Now, whether the clearinghouse forwards it on to insurance carrier or you filed directly to the insurance carrier, once that claim gets to the insurance carrier, they're going to check it again. They're going to check for data errors. They're going to make sure that that patient's insurance is still eligible. They're going to check all this information. So you may think a patient comes in and they give you their insurance claim or their insurance card and say, this is my plan that I have. Now what happens? So we all know you enter that information in your computer. You send out the claim, maybe the next day or the next day or two is when your insurance information is all compiled and you're able to batch out your claims and send them out. So it may be done the same day, maybe done that evening, but typically it's not done right when the patient's there because you need the information to send along, the CPT code, the ICD-10 code, why they were seen that day. So once that claim actually gets to the insurance company, could be 3 or 4 days after the patient was seen. What happens if that information is not eligible? So checking a patient's eligibility is very important when they're there in the office. And we're able to do that through some of these data interchanges, or if you have a phone system or you have a website you can use to verify a patient's eligibility. That's very important, especially when you're dealing with medical assistants, because that can change daily. So some of this information is very important to check, because once it gets to the insurance company and they deny it, trying to get that money back from the patient for the service they received could be difficult, dependent upon your office, dependent upon your procedures that you have. So the insurance carrier is going to check it as well. They could send it back to you with a claim, or they're just going to process it. So we used to file paper claims all the time, and then we got electronic, which was really nice. But you can still file paper claims. So Medicare actually has rules for who can file paper claims. So if you're what they consider a small provider, so a provider with fewer than 25 full-time employees, or a non-provider with fewer than 10 full-time employees. So whether you're a provider or non-provider with Medicare, you need to be a really small office in order to file paper claims. And if you have, there's a lot of, it breaks down all this information into a couple pages describing what a full-time employee is. You have full-time employees and part-time employees, kind of adding them together to see how many you have, to see if you meet the requirement to file paper claims. So if you're a very small office, a one doctor office with, a couple staff members, this might fall on you that you can file your claims paper to Medicare. Of course, anything you file paper is going to take longer and come up with the risk of being misdirected and never received at the insurance carrier. So we all know mail can get lost. So Chapter 24 of the Medicare Claims Processing Manual, Section 90.1, talks about the small provider some more. So if this is one of your categories, then that's where you're going to want to go to look it up. They also have a couple exceptions that they allow paper claims. One of those is what they call roster billing for inoculations or vaccinations. So your example could be your local senior center, or like Giant Pharmacy or Giant Grocery Store or Rite Aid, or some of those facilities that offer the flu shots. Certain times of the year, you'll see the signs out front, come in and get a flu shot, get $5 off your groceries. So what they do is on these claim forms, they can attach to a claim form a roster of all the patients that they provided this vaccination to, and then get it claimed, reimbursed that way. So they send in just one claim and attach almost like a spreadsheet of information of the patient's name and identification number and date of birth, because they all received the same service. So it's all going under one CPT code, all for the same reason, the one diagnosis code. So they said they could compile all that information for ease of convenience and send it that way. A Medicare demonstration project, that's all your new services. So if you're part of some kind of drug group or medical equipment, trying to find some kind of new service that you're billing, they allow you to do that on paper. There are certain, again, these are all in Chapter 24 of the Medicare billing manual. So if this falls into you, then if you're in one of those working for, one of a medical supply company or something like that, where you're providing a new service, then there are certain rules. They sometimes allow electronic and paper, so you want to look that up. But if you're providing a new service, you may not be codes established. There's documentation you got to send along with it. So those demonstration projects, they allow you to bill a paper claim as well. Of course, your Medicare secondary payer, when you have more than one payer, and that's where we got into some of that coordination of benefits. What if they have work comp and then Cigna primary and then Medicare? So there's a lot of different ways that you could have more than one payer. They'll want that claim paper as well. And then they have some unusual circumstances as well that they outline. So typically, you're not filing a paper claim to Medicare. Well, what about some of the other carriers? You could file a paper claim to a commercial carrier or a private carrier. It could be something that requires additional documentation, like you have to submit an operative note or a letter of medical necessity for a supply, or maybe a physical therapy prescription or something like that. Your secondary carriers, you might be sending paper claims because you need to include the primary explanation of benefits. They need to know what the primary insurance carrier paid and what the remaining responsibility is before they will process the claim. So they want to see all that before they're going to send payment. And typically that's done secondary carriers via paper. There are some carriers that allow it electronically, but you might want to check with the carrier. And then if you have a small insurance carrier, like we talked about, some of those small employer health groups or a union group, they may not have an EDI established in order to accept your claim. So you need to file a paper claim to them. Whether you submit it paper or you send it to a clearinghouse and they submit it paper, that would be up to whatever practices you have already established in your group. But they might take a paper claim, which means they're going to process your claims a lot slower. So anything that goes paper, you're looking at least 30, if not 60 days. Typically, the average is about 45. So you want to make sure that you're following up on your aging reports and make sure that you're following up on these claims to make sure that they get paid. If you've never seen a CMS 1500, you might refer to it as a HCFA 1500. That's the old name. CMS 1500 is the new name. And this is for our outpatient services. These are our physician services. Anything inpatient, you're doing a UBO 4. So this is outpatient. So our top half, I broke it into halves. And this is the sample off any website you can find it on. Most of the insurance carriers have a link to it as well. The top half you'll see is all of your demographic information. So your insurance carrier is in the box 1. You need your ID number, you need the name, the date of birth, who they are in relation to that policy holder. If there's other insurance information. Now that box straight in the middle, number 10, that's pretty important as well. Is this in relation to an employment injury? So is this workman's compensation? Were they injured on the job? Were they injured in an automobile accident? Was it some other kind of accident? And of course, the ever important signatures that are in the top. Your patient's not signing every one of these forms, but when you get the information either on paper or through some kind of kiosk when the patient registers, that's when they're signing. So you have their signature on file. So that's typically what's printed in this field is signature on file. You already have something from the patient that they sign off on as their agreement that your insurance carrier can request information as well, and that the payment you want submitted to your doctor or your provider that you're seeing. The bottom half of this form is where we're going to put all the information from that day specifically, or a group of days if it's some kind of inpatient hospital for the physician services. So you might see what's the date of injury? Well, that's important when? That's important when you have a work comp claim. They want to make sure it's for that specific date of injury. If you're somebody in an orthopedic office, they might be coming in there for multiple injuries. So their reports are filed by a date of injury. So you need to distinguish that. They use that for pregnancy as well. So your date of your last menstrual period. If prior authorization is needed, that field, that's on here as well. We have 12 places for diagnosis codes, which are all referenced by a letter of the alphabet. And that will, under the group E diagnosis pointer, it will say A and D or ABC or however many diagnoses you've indicated for that CPT code for that date of service in place of service. So if you have a place of service that's different than your office, that's going to go on here as well. Under 32, your service facility location information. Where were you? One of the most important boxes, so if you're taking any kind of CPB test, this is going to be one of your questions most likely. One of the most important boxes is field 17. So field 17 was established as the National Provider Identifier, your NPI. Every provider has an NPI that is required in this field 17. So if you have a service that required a referring physician, say an x-ray, a consultation, something like that, that's required information. So that's where field 17 is going to be filled in, is your NPI information of any referring providers, as well as the NPI information in box 33 for the provider themselves performing the service. That all needs to be in there as well, along with the J box there in the very end. So this form is very important. There's a lot of things on here that have to be filled out in order to receive payment. Now, you're sending your claims electronically. You're not using one of these. Well, these all equate to what they call loops. So when you send your claims electronically, these fields are being populated in an electronic version of this form. So they are very important fields, even if you're not sending a paper claim to your insurance carrier. They all need to be filled in, whether it's electronic or paper. So in this claim process, we talked about a clean claim, and you'll hear that. Whether you had a clean claim and you think, what was wrong with my claim? Of course it's clean. So it's a clean claim. You have all your correct demographic information. It's filed timely. That could be a not clean claim. That's going to result in some kind of kickback or denial. So you don't think of that as being a clean claim, but there are certain requirements in order to file that claim to the carrier. And one of them is you send it in time. Now, I did find one of the sites specifically. I went to every one of the major carriers to obtain their information about claims processing. So if you have any other information, go straight out to Cigna Claims Processing. Go under Provider, go under Claims Processing. They got all the information you need right there. Aetna, Medicare, everybody includes all the information on their website. So here's just a link, for example, to Cigna. This is what they consider clean claim requirements. So if you're curious why they kicked back a claim, you could pull this up and go, oh, okay, I didn't include that information, or that box is missing. Once it gets to the insurance carrier, they're going to do an adjudication, and they'll hear that term, adjudication. That means they're checking the validity of that claim. They're going to check the benefits available. They're going to check the effectiveness and the eligibility of that patient and the validity of the information on the claim. Does it meet the medical necessity? Did your ICD-10 code meet the CPT code you included? So the validity of the claim. And then the adjudication also includes the amount that that carrier is going to pay. Well, they also have to take into account any of the patient's benefits as well. So say they're going to pay $100, but the patient has a $50 deductible. So they're really only going to pay $50 because the patient owes that other $50 as their deductible. So the member benefits are also going to be accounted for when they go into adjudication. Then you receive your payment. Most payments, the majority of all payments, are sent electronically. So when you file with an insurance carrier to have them accept claims from you, you're also going to fill out an EFT, an electronic funds transfer, and they're going to submit the information straight into your bank account. And then they will also send you an electronic remittance advice. So you'll know you can match up that $2,000 payment went with this $2,000, 10 patients listed on this remittance advice. Those are all the claims that have been paid for that amount. Or they could send you a paper check still. Workmen's compensation carriers might send paper claims or paper checks. Some of these small union companies, a secondary carrier like MetaPlus or AARP, or some of them may send paper checks, but most of them will still come electronically as well, especially if they have a lot of patients that they're processing claims for, they might do electronically. So now you get a denial. So why did they deny that claim? I sent everything right. Those codes go together. I checked it in the book. Well, there's certain things that they might deny it for. Timely filing is probably one of the biggest things you need to keep track of. So the insurance carrier, we all know that this happens. Sometimes a charge didn't get submitted to the carrier, or it got stuck in your computer glitch that day, or if you do a paper, the doctor had it buried under something and you get it late. Can you still file it? So that's one thing you need to look at. Now, every insurance carrier you work with, you have a contract signed with, and not every carrier is the same. So your Blues plan might allow you 1 year. Medicare is 1 year. Workman compensation, they may have no timely filing. It depends on the carrier. Aetna might be 90 days. So you signed a contract, your office signed a contract with the carrier that they will submit these claims within a certain amount of time. So if it's denied, it could be because you didn't file it in time. And then that's your office's problem, unfortunately, and you have to write that claim off. An interesting question did come up among some officers on the AAPC group yesterday, that somebody had said, well, what if the insurance denies the claim and we took the patient's copay? Do we have to send the copay back? The first place that we direct anybody to for that is your insurance contract that you have. Do they allow you to take that copay? Because that was the patient's contract with their insurance plan, that they will pay their copay, not the insurance. So it could be some carriers might have you reimburse the patient. So that is something you need to look into for any of these denials. If a service is inclusive, and when we do charges, we all know this, that they may not want those two codes billed together. Not that they're bundled, but they think that that one service is typically, once you're in that, okay, orthopedics, surgery claims, knee claims. This happens all the time. Medicare NCCI edit doesn't say so, but the insurance carrier thinks that those two things are inclusive of each other. So if you're already doing that one part of your shoulder, then you're already in there, it's usually standard procedure. And that could be just an insurance carrier rule, not NCCI, nothing else. It's just the guideline from the insurance carrier. If you didn't get the authorization, you know, that you didn't know it required authorization, or you didn't have a referral or something, that could deny a claim. They request just asking for more information. They could deny the claim requesting further information to review. Now, there is a website that I included here. And you'll see in red off to the side, these are all the codes that we said they're standardized, that all the insurance carriers use these codes to describe denials for their services, whether it's a PR, a patient responsibility, a CO, a contractual obligation, or whatever they may have as the prefix of the denial code. And then there's usually a number indicating. So you'd click on the link for what you're looking for, you go down the list, and that's what the denial is. Now, why would you need to look that up? So you're looking at something, you got a 25-page explanation of benefits from the insurance company. They paid 200 people's claims on there. On the very last page, they're going to indicate what all of those codes were that they included on that specific explanation of benefits. If you click on one of these, when you go to this website, you'll see there's hundreds of them. Well, they don't print that on every explanation of benefits. They only print the ones that they used. Well, you're on page 4, and that's all that you received back. Well, what does that mean? You can't find page 25 that had all of them on there. You don't know where it wound up. Could be in the shred, it could be scanned in somewhere wrong. Well, if you go to this website and you look it up, you can know exactly why that claim was denied. Was it because it was timely filing, or was it because the patient wasn't eligible on that data service? So each of these codes are going to be listed there, and you'll know what that denial reason is. So what do we do with our denials? Do we just, oh, well, they didn't pay it, write it off, and go on to the next day? Or can we do something with that claim? So it all depends upon the denial. It all depends on the reason why. So here's an example of some of those codes that they might have. It's missing your invalid group information. So box 33 on the bottom wasn't filled in. You didn't have your group information in there. So this is just a very small snippet of the entire list of claims, because there's also different categories you can click on to get these claims, denial codes. So can we do a correction? Now there's a corrected claim and there's an appeal. They are two different things. So sometimes if you're helping somebody else in the department, you want to get into this field, so you're helping there, but you're normally a coder, or the physician just says, appeal it. Well, you know, somebody doesn't understand these words. There are two different things. They mean two different things, and they're two different processes as well. So when you do a correction, you're correcting something that was wrong. So you sent the wrong data service. We all do this. If you do it manually, January 2nd, 2019, you might accidentally put in January 2nd, 2018, because for 365 days, you typed 2018. So now it's 2019 and you forget to type that. Well, that doesn't mean they weren't seen. It's not past timely. You got the wrong date, and you can prove it. So if they wanted to show proof, well, here's the day the patient signed in on our electronic keypad, and here's the note from that data service. I just typed it wrong. So you're just correcting that information. Oops, I put in M25.2 versus L25.2 for my diagnosis code, or something like that. I switched around, I inverted the patient's first two numbers of their health ID number. You're just correcting an error, a typographical or some kind of data error, that something was wrong. So that is a corrected claim. So most insurance carriers, you can just resubmit that claim electronically. So you don't have to go through any kind of process. You just go into your practice management system, correct what's needed, hit resend, and send it back out again. Now, if it happens to come back saying, you already sent us that, it's a duplicate, well, now you got to write in an appeal and say, well, look, compare these two. You know, here's the correct note, the data service, I entered it wrong. Okay, or just call them and, oops, I did a wrong date. Where But they, again, have rules as to the timely filing of when you can accept one of these corrections. Now, on the Cigna's website, and I provided the link, they allow 120 days for you to correct information that has been processed. So they sent it back to you, they denied it, they said that past data service was past timely filing, you change it to 2019, you have 120 days to send that claim back to them and get it reprocessed again. Aetna's 180 days. So I included their link as well as about their information for a corrected claim. Medicare is typically 120 days if they allow for your information to be corrected, or if they didn't even process it in the first place, you got the 1-year timely filing. If they didn't even process it, then they didn't get it. They didn't do anything with it. You don't have to worry about any type of steps. You just correct the information and send it in again. So or they'll accept things over the phone or an EVS system, or it depends on your MAC for your area. They might have, like we have Novitas, so we have Novitasphere, so we can do it all online. So we can correct information, or you call and you push in wrong date or something like that, and send it in. Some insurance carriers, for a corrected claim, they might have a form. So you want to make sure you've been on all of your carriers' websites and you have all of that correct information. Whether you put it all on a spreadsheet and hang it up there in front of you on your wall, or have it in a binder or something like that, maybe a tab in your Outlook for corrected claims, label it corrected claims, and then list each carrier's requirements and double check it a couple times a year and make sure that it hasn't changed. If your insurance carrier updates things every July, you want to make sure on July 1st or July 10th or somewhere around there, you go in and make sure they didn't change any of those requirements. But if they do it every December, then January 1st, go back in and see if they changed any of the requirements and update your information so you know how long you have. There are also, your state could have a requirement in place as well. If your contract doesn't specify or the insurance carrier doesn't specify, check with your state's requirements as to what they allow for insurance claims. So there's different ways of correcting a claim, but remember, a correction is you're not writing an appeal. And a lot of times they want you to send it electronically. Like, we're Care First Blue Cross Blue Shield of the National Capital Area. So we go to carefirst.com and there it says on there, send all of these different kind of changes, send them electronically. That's how they want them. They want their computer to process all that information. They don't want to be inundated with more paper and have it sit on somebody's desk. Have the computer process everything. And if it has a problem, it will spit it out. And then you go to this appeal process. So an appeal is typically is denied for bundling, medical necessity. You have to ask for a retro authorization. The physician said they were going to perform this type of elective surgery, but then when he got in there, he said, "Oh, okay, wow, that's not it. We got to do this other code," and that other code required authorization, but you didn't know it. So you need to, write an appeal. You need to write a letter asking them to redo their information. Look over this information. Here is the information that will get you to pay this claim. If you're disputing the amount that they paid, say your fee schedule's higher and you want to know why they paid low, those are when you're going to write an appeal. Again, I pulled up some of the major carriers, and this is some of their information. So you can have it, but again, keep it on a spreadsheet or some kind of format that you can have it accessible to you when you need it. If you work on your claims, once at the end of the week, every Friday, you devote to your appeals or your corrected claims. You want to make sure you have that information accessible. Cigna requests that you call their customer service first for any resolution. They might be able to go in and change that January 2018 to January 2019. Again, that is a corrected claim, but they ask you to call their resolution service first. And this website actually tells you what to call in for and what to appeal. A paper appeal process form, and that's where the form is there. That's the link for the form. But I think I gave under the corrected claims on the last page, that's where they list their corrected versus their appeals. So if you're seeking an authorization or a retro authorization, you're appealing their authorization denial that they sent for services prior to being provided to the patient. So say you were seeking authorization for a surgery and they denied it. Well, you can appeal that process. Your claim hasn't been submitted yet, but this is where you can appeal that process. You're appealing the reimbursement that they sent or a medical necessity. They have a form. You fill in all the checks and you send it with the requested information. Aetna says within 60 days of their original decision, you need to send an appeal. So that's pretty quick. So if this is your job, you need to make sure you're on top of it. Or if this is a job you want to get into, you need to understand that some of these things are very important that you take care of right away. They can't wait. They can't sit on your desk for a free hour at the end of every month, because you might lose some time there. And if you don't get that appeal in time when they ask for it, there's no going back. There's no getting that service repaid. And they have a link as well that they provide you with the address of where to send it to, because sometimes they break it down. I know in the past they broke it down for what part of the United States you were in. They had a different address. So that's where they give you all the information of what to appeal and where to send it to. Care First, because there are so many different Blue Cross Blue Shields. You have Anthem, you have Independence, you have Care First, National Capital, you have, Anthem could be in a couple different parts of the United States. Go to their website and look it up for your local carrier, because it could be different. They could have a form. They could request that you do it online in their online portal. So there's different information required for appeals per state. And Medicare is the same. You see what your local MAC carrier has. But Medicare has levels. Medicare actually has 5 levels. So there's a lot that you could appeal. I've never gone higher than a first level, because typically Medicare's right. So, if they say no for some reason and, you're trying to get around it, unless it's some kind of new surgical procedure or something like that. But typically, what Medicare, the information they want, and that's what you're typically sending in to them anyway. So you're not usually having to do much more than a first level redetermination. Now you'll notice that they call a reconsideration a second level, or another insurance carrier might call that their corrected claims. They might call it a reconsideration, like United Healthcare. So a lot of people use these terms interchangeably. So check with the carrier and make sure that you know what they're talking about. And I said, if appeal rights are given, because you'll see that as an explanation on the explanation of benefits, you have 120 days, or it will say no appeal rights are given, resubmit this claim. So that's one that you can just correct the information and send it back in again. It's kind of like they didn't process it the first time. They're asking you to resend it in again. So you don't have to do anything. You just correct the information, hit send, and it goes off to Medicare. A redetermination could be done online. It could be a paper that you fax in. It depends on your local MAC carrier. They're all different. But the Medicare Claims Processing Manual, so this is CMS.gov, the governing entity of all of the MAC carriers. Chapter 29 of their Claims Processing Manual, they discuss appeals, redeterminations, reconsiderations, those higher levels, judiciary, some of those other higher levels for appeals that they have. All of those steps are explained in Chapter 29 of the Claims Processing Manual. If you don't have the Claims Processing Manual, that's the link right there. That's to get to 104. You'll hear that. And it's got all of the chapters in there of every kind of claims processing question you have. Incident 2, physical therapy, skilled nursing, inpatient, outpatient. Everything that you want to know about Medicare billing is at that website right there. So all carriers review their guidelines. So we're getting ready to send an appeal to this insurance carrier because those services are not included check the NCCIs. Make sure that the NCCI edit didn't change that quarter for the data service that you're in. Make sure that that insurance carrier, that Aetna, doesn't have a guideline of their own personal guidelines saying you cannot build those things together, or those things can only be built together if you meet criteria 1, 2, and 3. So make sure that there's nothing on their website, and double check those NCCI edits before you send off an appeal. The appeals take a lot of time. You have to copy information, you got to word it all, make sure you got everything all together, mail it out, follow up with it. It takes a lot of time. So you don't want them to come back and say, well, per our guideline right here, guideline number 26, we don't pay for that. And then you just kind of wasted all that time. So double check all that first before you're going to write your appeal letter. So if your insurance carrier does not have a form that they want you to send in, you're going to write a letter. What do you need to include? The member name and the member's ID number. Very important, of course. They're not going to know who you're talking about. Your provider name, your NPI, your TIN, whatever they identify you as, some kind of group ID number, whatever they identify with your particular carrier as. That claim number off of the explanation of benefits, not the patient's claim number, not a work comp claim number, something like that. I mean the claim number when they come and send you back the explanation of benefits and they say John Smith, January 1st, 2015, date of service, claim number 1234567. That's the number that their computer is going to attach and reference for this particular claim. So that's the number you want to include about this claim, because what if that same date of service, you don't want to just say date of service January 1st, because what if it's a surgical claim? You're going to have date of service with the facility, with anesthesia, with durable medical equipment, with physical therapy, rehab, a consultation, anybody else who might have happened to have interacted with that patient on that same day, you're going to have a claim for. So you want to attach that claim number so they can go exactly to what they need to know. The date of service is very important. The reason for your appeal, of course, and we're going to spell that out. Any supporting documentation you want to include. That would be their medical records. And again, I've made a reference here, only the minimum necessary information. That's actually part of that HIPAA law as well, that you're only including the information that's required or requested in some cases, but only the information that's required to deal with that. You don't want to send the entire medical record proving that for the past 6 years they've had this problem. That should all be standardized and stated by the provider in one of his notes. This has been going on with the patient for 6 years. And if they require all those medical records, they will ask for them. But we are only sending them what's minimally necessary in order to process this claim. So whether it's the operative note, and that's it. You can have a radiology or a laboratory report, a letter from your provider if they need to certify some kind of medical necessity for an equipment or a durable medical, or to have a service, some kind of letter from them indicating, or even a letter indicating why they performed that. Whether it's you use an association journal, the American Family Pediatric Association, or this is guidelines from them, or we use the AAOS, the American Orthopedic Academy. So, we use something that they publish sometimes and say, this is why orthopedic surgeons perform this service. Who's this letter going to? So somebody's going to get this letter, whether it's a customer service representative, it could be a nurse, because some of these levels, they might go a little bit higher, might go to a nurse. Is it going to an orthopedic surgeon when you're doing an orthopedic appeal? Maybe not always, only if you request it. So you could have, a nurse who worked in the ER all the time and now works for an insurance carrier reviewing claims. That's possible. Maybe they know a little bit more information. Or you could have a lab tech. It used to be in their former job a lab tech, and now they work for an insurance carrier. So you never know who you're going to get. So you want to include as much information as you can to support, especially when it comes to medical necessity or any kind of supporting documentation as to why you want the service paid. A copy of the explanation of benefits. So in case you got your number wrong, in case they want to go exactly to that claim so they can know why you're sending it in. And of course, your name and your contact information, very important. So if they do happen to call you, which I've only a couple times had an insurance company actually call me back, but you want to make sure that they can get a hold of you. So now you're going to write up your letter, you're going to send it off, you're going to keep a copy of that letter and any pertinent information you attached. Of course, you don't need to keep a copy of your medical record, because in your letter, you're indicating the medical record you're including, and you can just go to your EHR and get that. It's just one less thing to have to copy, more paper, kills more trees, and just it could be time. It could be if it's a 7-page note, that's extra paper to include. You definitely want to make sure you follow up within 30 to 45 days. On some of those websites, they indicate, Aetna's does and Cigna's does, we will get back to you within 60 days. If you send an appeal, you will hear from us within 60 days or 30 days or whatever they indicate. So you want to make sure that you're following up with them. What if they never got that? You got to send it in again, and it needs to be timely. You've only got that certain amount of time to send it in. So you want to make sure you're following up, and you're going to document the name of every person you talk to. So here's your letter. You got it all written up. All your stuff's attached to it. March 10th. Nancy at 1-800-555-2121 says claim has been received, sent off to supervisor for processing. Okay, now on March 31st, you're going to call back again and they're going to go, oh, we don't have it. And you're going to say, no, I talked to Nancy at this phone number and she told me, and you can try and support all your information that way and be consistent with your follow-up. Make every Friday your follow-up. Every Monday, start your day off by calling an insurance company. So, the slow days of the week for an insurance carrier are Wednesday or Thursday. So maybe call every Wednesday after your lunch break and work till the end of the day, following up with your claims or something like that. So keep it consistent. You don't want to have in the back of a folder somewhere an appeal you sent that you followed up on 6 months ago, and you'll just call today and find out where it is. So you want to make sure you have consistent times in there that you're following up. So what would you write? So this is just a small example. I would, of course, format this a little bit differently, but for space in this slide, this is how I did this. Of course, I'd have more spaces. I wouldn't have the patient's name, ID number, and date of service all on one line. You want to make sure it's information that they can see. You don't want a jumbled mess. You don't want to read it. They don't want to read it. So they want something clear and concise. They can see everything right away. So your date, who's it's going to, regarding the patient's name, their ID number, the date of service, that claim number that you got off of that explanation of benefits. So I am writing to request an appeal for that services rendered to the above named patient. The patient was diagnosed with whatever your supporting medical necessity in this letter. Per the attached MRI report dated November 1st. The patient has been through physical therapy and the standard drug protocols, because we encounter this a lot. In order to perform some kind of surgery, they want to make sure they've done all the other non-surgical steps first. So they've been through physical therapy, they've been through the drug protocols for the relief of the symptoms. The providers determine the patient requires surgery to correct the concern as the patient's having difficulty performing their daily living, especially when they get to that point, they're going to need surgery, because if they can't get to work, if they can't get up in the morning to get the kids ready, if they can't perform their daily functions, then that's usually a point we want to do surgery. The surgery would return the patient to their proper functioning format compared to others his age. However you word it, whether you want to get your provider to mention, how did what do they want to use, whether you have a stock letter you use for every single one. You might need to, change things up a little bit depending upon the reason of the denial. So I've included the operative report from that day and the MRI report for your review. Please don't hesitate to contact me at this number during these hours Eastern Standard Time. What if you're talking to somebody in California and you want to make sure that you're indicating that you're on the other coast and that there's a 3-hour time change? So you want to make sure you're including all this information in there. And your name, if you have a credential, include it. You want to support that you know what you're talking about, for one, and you earned them. Where you're at, your tax ID number, maybe the office website. You might include your personal email as well. Some other information you might include on here would be standard with your office typically. And then we're going to attach to that all the information we said we'd attach: a copy of the claim, a copy of the explanation of benefits, that MRI report, all this information, make copies of it, staple it all, and send it off. Typically, when you're setting an appeal, say you're doing all of Aetna's on one day, you want to send them all individually. You don't want to send, yes, it's more postage and yes, it's more envelopes, but you don't want to send a whole stack that possibly the insurance company's protocol then is, when I get something this big, it goes to this person in this department and it's going to sit on their desk. So you want to make sure that you're giving each one the individual attention that they require and make sure that they're all getting processed properly. Appeals, denials, it can be very frustrating. The one thing that, of course, you want to make sure is you're reviewing that claim. You're taking the information that you know from coding, from an insurance carrier's website. You want to make sure you're taking all that information in and that you actually sent the information correctly. There's nothing more nerve-wracking than feeling like you're holding up this claim and then they go, oh, well, you used an ICD-9 code. And you're like, oh my gosh, okay, you're right, so sorry. So you don't want to be embarrassed by it, but you also want to prove that you know what you're talking about. So if you've double-checked everything on that claim, you've double-checked the provider's or the insurance carrier's website, you've double-checked your NCCI edits, and you know that this claim should be paid, the provider has this letter written indicating why the patient had a procedure or an office visit or whatever the case may be, you want to prove that you know. So what if your claim was denied for timely filing? Do you have information to support why it was submit late? So on the website for the Medicare manual, they include in there some exceptions as to the timely filing. How can you file a claim past 1 year? Or how Aetna has a 90-day, but I had to submit it to the workman compensation carrier first because they said it was a work comp claim. But then if it comes back denied at 120 days, I want to support that information that I did send a claim timely, but it had to go to the work comp carrier first because the patient filed a work comp claim for that injury. So there are cases where you could get around timely filing. If it was lost in the provider's inbox, you can't really get around that one. That's unfortunately, that's just a missed visit. You're not going to appeal. Don't lie in these letters because they have tracking, there's computers, where things, you don't want to lie. So just make sure that your information is correct before you're sending out an appeal is probably one of the biggest things, along with following up those appeals. If you do a lot of appeals, review the information. Find out why you're sending a lot of corrected claims. Is somebody forgetting the 25 modifier? And maybe we need to let your business manager know that we need some more training again. If you're finding things consistently, contact your insurance representative and have them look into it. Say, why are all these claims keep getting denied for this reason? We filled in box 17 on our claim form. Maybe there's a hiccup in the clearinghouse information, or maybe there's something that's not transferring properly. So sometimes if you get things a lot of them happening, definitely investigate it and find out why, because you don't want to be continually sending these letters because they do take a lot of time. So if there's any appeals denial, say you sent off this appeal, great, everything's included, you have everything on there, you sent off your appeal, they denied it again. They denied it for some reason. See if there's a second level appeal. See if there's a peer-to-peer available. Maybe your dermatologist needs to actually speak to a dermatologist, or your cardiologist needs to speak to a cardiologist. So request a peer-to-peer. You can request those in writing. You can request to have a physician of your practice, similar practice type, reviewing that appeal, so that you can request that in an appeal and they have to honor that. Consult with your provider. Did you really do this service? It's not documented, or, you know, is there some other way? Is it something that you do every single time? If it is, then maybe it would be considered inclusive. Is there something more that you need to know? Is there more information? Is there maybe a journal letter that can uphold why that provider did that surgery? And you can also ask the patient. So if you've gone through your appeal process and they're still denying for some kind of medical necessity or something like that, if the patient's going to be held responsible, you definitely want to get them involved. Under the Affordable Care Act, the patients can also request an appeal. There is an internal and an external appeal process that can be done. And there's a link there from the HHS describing this information, allowing that patient to submit an appeal as well. Sometimes they'll listen to the patients a little bit more than the provider. So maybe get the patient involved if you need. Lastly, it just might have to be an insurance adjustment. We hate that. We've done everything we could. We filed everything properly, but if they're not going to pay it, then sometimes there's, you know, you can only fight so much, and we hate to do it, but you don't want to make the patient responsible, especially if that explanation of benefits does not say the patient's responsible. You cannot make them responsible for something that the insurance company says they are not responsible for. So unfortunately, the provider just provided a free service. So we don't like to do that, of course, but you know, you reach a level that there's only so much you can do. So we'd love to have all of our claims paid. We would love to have everything go correctly the first time and not have any problems. But there's a reason why we have this billing, and there's a reason why on the back end, some things are very important to get covered, to get taken care of. So let's see here. I have a couple questions, and let me look through them here real quick. Okay. One question, I'm going to go through all these. I might have to get up and lock my door because my son will be home in a minute. When are we to use an authorization number? Only on inpatient records. Medicare doesn't have authorization numbers, of course, typically. If the insurance carrier requires it, United Healthcare sometimes uses authorization numbers. Cigna, that's typically when you're referring to surgery.